And good morning, everyone, and it's a great pleasure to welcome you um, to training and to the college, and especially because I'm a chemical pathologist myself, and only the second chemical pathologist to take up the role of president, the last one being over 40 years ago. The main point I want to stress is that the college is so important to all of our careers, and especially during training. We're not just about providing exams and providing, guidelines and so on. We're very important in terms of representing all the disciplines that fall under the college, and that's becoming increasingly important in times of problems in the NHS, problems in healthcare, lack of funding, and so on. So we really need that strong voice, and that's an incredibly important part that the college does. As well as the important members of staff that we have in the college is really about all the volunteers that we have, and these come from all the 17 disciplines, and there's a huge opportunity to get involved in the college as your careers progress. In terms of biochemistry, we have three main areas to highlight, some of which you'll be hearing more about later. One being the SAC committee, and that's now being chaired going forward by Professor Eric Kilpatrick from Manchester, who will certainly be known to some of you as the time goes on. And Vinita chairs the specialty training committee, and you'll be hearing from her later. And the final piece of that jigsaw is Kevin Deans, who you'll also be hearing from, and he is the panel chair, the person who leads the examinations, the RCPath, which you'll come to both love and hate, I'm sure. Taking a step aside from the biochemistry-based committees, the college is really, in terms of volunteers, right at the top are what's called the honorary officers, and that includes myself. We now have 4 vice presidents, plus a registrar and finance person. Those 7 people are the people who take up most of the sort of front line of the college in terms of the business that we do. We're all volunteers. We do it on top of a day job. We don't get paid, and so we're always juggling other things as well. So we have to always bear that in mind. But there's a huge number of other important people that volunteer for the college. All the committee chairs, all the directors, and of course people like examiners, and across the college we have over 1,000 of those. And so we're really dependent on everyone stepping up. The college is not something that sits out in the sort of open. It's not a them and us. We are all part of the college, and the college can only survive if we remain part of it. So the college emphasis here is that it's so important, and it's so important throughout your entire career, and I really urge you to get involved and support it in any way that you can. Pathology is obviously not just about chemical pathology, but as I said, there's 17 different disciplines, and they're hugely different and diverse, and also overlap. And they vary from pretty much lab-based disciplines through to very clinical-based differences. So hematology, microbiology, our own chem path, and then histopath, being the main disciplines. But as I say, there are 17 in total. What we do, obviously, in pathology is not just about diagnosis, but it's about screening, it's about prevention, and of course, for ChemPath, many of us are involved in direct, management of patients, either in outpatient clinics or even in ward rounds running clinical services. So it's important that as you progress through your training, obviously in ChemPath, and you'll hear more about that later, there are obviously different bits of clinical areas that you have to become knowledgeable and proficient in. But there's also the laboratory side as well, and I really have to emphasize that. Most of us are stepping outside of our comfort zone when we come into training, because the laboratory side is something that most of us won't have done much of before. And yet there is a certain amount of knowledge that you have to begin to accumulate, and that certainly will be tested in examinations. But it's also about trying to get as much experience and exposure as you can, so that you can understand how laboratories work. Because one day, day one in a consultant job as a chemical pathologist, you might find yourself in a relatively small department as the only person there managing everything, and that includes the staff, that includes the contracts, and that includes all the testing and clinical aspects as well. So there's a lot to learn, there's a lot to experience, but I would certainly advocate that it's a very enjoyable experience. You all have chosen chemical pathology, and we really thank you for doing that, and I wish you all the best going forwards. There are a few areas just to pick up on. Research is something that is not part of the curriculum to a large extent, but it's something that some of you might be interested in. And I think there are huge opportunities to get involved in research. Pathology is very well placed to be important in huge numbers of research projects that exist outside of labs, and that's because most clinical care involves pathology testing to some extent. So this is where we have huge opportunity to take advantage of all that data that our laboratories hold, and research is something that is always seen as difficult to get your foot over the door, but certainly when I was a trainee, the trick was to just try and get involved in as much as possible, be helpful, and some you win, some you lose, but more than often there are good outputs, and you can get involved in some very high level research units and teams, and that would be the way I would approach that. For some of you, of course, you might be interested in more formal academic training, and again, that's something that you'll have to think about carefully, but there are some opportunities out there as well, for setting yourself up with research degrees, but also looking towards future jobs that are not necessarily NHS jobs, but are more based in university-based appointments. I left chemical pathology in 1999 and went straight into an academic post for 4 years, and learned a huge amount during that 4-year time. It was actually in health services and public health research, with laboratory aspects, and that's where I learned most about research aspects. I came back to the NHS though in 2003, and that wasn't because I was fed up with research, but I realised that the type of research I wanted to do, I was actually better placed to do it from within an NHS job, and I would certainly stand by that. For other research, of course, you have to be in an academic post to be able to utilise all the sort of opportunities that kind of job brings. But it's early days, you've just started, and there's a lot of time to think about these things, and these things will evolve over time. It's always difficult to publish papers, but there's lots of other things you can do as well. I certainly spent a large part of my training period, just gathering audits, gathering case reports, bringing together small amounts of data and presenting them as posters and sometimes oral presentations at meetings. And that's an excellent way of getting your foot in the door and getting yourself seen. And I would certainly recommend that. Most people coming out of training, even at consultant level, have barely published anything in terms of papers. But certainly by the time I left my training period, I had managed to publish over 100 peer-reviewed abstracts and posters, and that's something that we can all do, and something you should certainly turn your attention to, at least in the short term. Teaching is also important, and you will get opportunities to teach not just other biochemistry based trainees, but undergraduates, other postgraduates, early stage trainees, scientists, both clinical scientists and biomedical scientists, and other allied healthcare workers. And many of them, you'll be working with them anyway as part of your MDTs. So it's great to get that experience and to use that as an opportunity to really sell the importance of what we do in pathology testing and how that fits into all the clinical roles that exist. Okay, I've covered job opportunities. Work-life balance. Many of us come in to the pathology disciplines because there is a much better work-life balance, and I would absolutely agree with that. But that doesn't mean to say that you work less or you don't work as hard as other disciplines. It just means that you have more flexibility to choose to do the things that you want to do, and I think that's incredibly useful. I mean, I have certainly chosen throughout my training and as a consultant, to work long hours and volunteer to do stuff. But I've done that mostly because I've wanted to do it, either to benefit me, my department, or ultimately patient care. Choosing to do it rather than having to do it makes all the difference, and you'll see lots of opportunities to take up some of those roles. The college is a relatively young college. It only formed in 1962, and it's here obviously to support all pathology specialties. It means that whatever specialty you're in, the college is there to support you, help you, and lobby for you, to have the support and the resources to be able to train properly, but also contribute to the kind of healthcare outputs that patients want and patients need. We have to recognise, however, the ugly truth of the NHS certainly at the moment, and it's not doing very well at all. Funding is incredibly difficult, and a lot of the time we can't do what's right and we can't do what patients need. We have to just do what we can based upon the resources and the funding that's available to us. It is a form of rationing, but that happens across the whole of healthcare. And that's why it's important that when we look at biochemistry testing in particular, we don't just look at what it costs within the lab. We look at the impact it has in the wider patient pathways. And I'm sure you'll come to realise, that is how we can help promote how biochemistry and testing is used. In terms of the next few years in the college is focusing at the moment on supporting, things like workforce, where we know there are huge deficiencies. We know we're not training enough individuals in many of our disciplines to fill the gaps that exist even now, and with the prospect of an increased workload in the future because of the aging population and arguably a sicker population, we know that we're going to see those gaps begin to get bigger. So we're putting a lot of effort in the college at the moment on trying to demonstrate, that there is a huge need to look at pathology training and ensure we have the right numbers of people coming through. Workforce planning, unfortunately, doesn't exist for pathology disciplines. And so there's a huge need for the college to step up and really let our voices be heard. The other areas that the college is focusing on externally, obviously, is trying to see how we fit in with things like the NHS England 10-year plan, and indeed the plans from the other 3 countries as well. And certainly, that becomes more and more important, because it's likely that all of the available additional funding is going to be made available only to those areas of healthcare that can demonstrate links directly to those plans. So plans that promote working in the community more, plans that support prevention, of which our clinical roles in ChemPath really fit into that, and also plans that that propose a move from analog to digital. Those are the areas that we're going to focus on through the way in which the college can work. So in terms of how you adjust your training to that, my advice would be, make sure that when you look at how services are running, both clinical and the laboratory side, just have a think about how it fits in with some of those wider government plans. And indeed, when you look at your career opportunities going forwards, you're training yourself effectively a lot of the time to actually fit into not what the healthcare system is like now, but what it's going to be in the next 5, 10, 20 years. And I think it's important to have an eye on that. And a lot of that information you can get from the college and all the different things that we do. Exams, you'll hear a bit more about those from others today. And the one thing I will mention is that exams are expensive, and we know that. We've all been through it. The college delivers a huge number of exams, multi-stage exams for 17 disciplines and some other groups as well. And we have a great team in the college that support that. And as I say, backed up by over 1,000 volunteer examiners. We don't make any profit out of exams, so it's not like we're just ripping you off. We try and make those exam costs as low as we can, but it's not cheap. And we recognise that that's difficult, especially in today's climate. There are some things to point out though, and especially that you can get tax rebates on those exam costs, which for most of you who will be in the 40% plus income tax rates, you will be able to get rebates of that from the exam costs. So don't forget about that. So your journey with the college really begins now, and hopefully that will be a career-long journey. And the college is there to support you all going forwards throughout your career in terms of CPD, education, guideline standards, and the way in which we advocate and represent the college to government, the media, and public. You'll see in the news today in the BBC website, they've dropped a bomb about the mistakes that have been made with hemoglobin A1C. So that's an area that we will, have been working, with NHSE on now and other providers for many months. So we are now in a position, where we know all about it, and we're able to make statements both to the media and to NHSE as well about that. And that's important because we need to ensure that as a college we're able to step in and make those points and make sure that the right choices and the right decisions are made going forwards. So welcome, you're now part of this college, and as I always stress, this is not my college, it's your college, it's our college, and I wish you all the best in the coming years as your training progresses, and I'm pretty sure that you will not regret your choice. I know I have never done so. So thank you very much, and I'll pass you over to the rest of the team. Thank you.
Thanks very much indeed, Bernie, for that introduction to the college and glimpse into the future. So next up we have Joe Brinklow, who I mentioned previously is the Director of Learning at the college and oversees everything about training and assessment and exams. So Joe's going to talk you through the role of the college with a particular emphasis on the role of the college in your training. So I'll hand over to Joe at this point.
Thank you, Ronan. I'm just going to share my slides. I'm going to rely on someone to shout if something goes wrong and you can't see what I'm sharing, because once I'm fully sharing this, So as Ronan said, I oversee the training, assessment and examinations activities at the college, also the international team as well, just because of the very close relationship between the international medical graduates that we work with, then their interest in training and examinations, and also the interest around the world with various institutions to the college for the work that we do in these areas. So as Bernie has said, this is your college. I've put a couple of pictures of the college in the corner here. We're based in Aldgate in London, quite near Liverpool Street. It's a lovely building, but the college isn't the building. The college is the people that are our members and our staff, and we all work together. But if you do get a chance to come along to the college, you might have an exam here in due course. Certainly the new fellow ceremony is held here, then you'll see what a lovely building it is. There's lots of things that we do at the college to support you as a trainee. There are lots of committees, but the key ones for you are the College Specialty Training Committee, and you'll hear from Dr. Mishra, who chairs that in a little while. There's also a Trainee Advisory Committee, and again, you'll be hearing from a couple of trainees who represent that committee as well. And there are also various SACs, and there's one for clinical biochemistry too, that oversee all matters to do. We develop all the curricula and the assessment systems that go with that go along with that. Also the examinations that have been mentioned, the ePortfolio, which for the specialty is the LEP system, and you'll also have access to ARCP guidance, the pathology portal, which you'll also be hearing about, and advice and guidance throughout training for anything that you need, for anything that crops up. And I think, as Ronan mentioned earlier, when you get to the end of training and you might think now, oh gosh, that's ages away, it goes really, really quickly, then we will be making a recommendation for you to go onto the specialist register through the CSTC. There are also regional structures within the college and regional representation. Though we're based in London, we have representation from all around the UK. And we also have external input to deaneries as and when required. There's lots of stuff in this list here as well about a lot of the other things that the college do, and you will come across some of these during your training, and then as you progress in your career and become a fellow of the college, some of these things will become even more important. As a trainee, you'll have access to the college bulletin, and there'll be various things that you will be able to take part in. There'll be conferences that you might be interested in. You might want to take up public engagement and run public engagement events. There are lots of opportunities to get involved as a trainee. As you progress, even once you've passed your part 1, you can actually become an item writer for the examinations, and then later on an examiner once you've passed your part exam. So I won't go through that list in great detail, but just to sort of give you another bit of an overview, this is a screenshot that I took from the front page of the college website this week, just to again give an insight into the breadth of work that the college does. You'll see there the second workforce census spotlight on morale and wellbeing. This is part of a whole series of workforce publications that's coming out, and I think the next one is actually about training. So very relevant to all of you. So do take a little bit of time to familiarise yourself with the website. You'll see there's a whole section for trainees, and all of us always highlight that. So I've taken that out of my presentation this year, but you'll see it very easily. But have a look at some of the other sections as well. So just a little bit about who we work with, because from our experience, it can be quite overwhelming when you're a trainee to really understand the structures, who is responsible for what. There's always a little bit of overlap. Sometimes it's not always clear. And the college really has a role and input with various different organisations. So just to give you a little bit of an overview about that. So starting at the top, we are regulated by the General Medical Council. So any curricula that we develop, any workplace-based assessments, any examinations, all need to be approved by the DMC before we can publish them or make them live. And a huge amount of work goes into that. and they're quite lengthy procedures to make sure that they are approved, that they are deliverable, and there is some more. I put some more information in about some other interactions that you might have with the GMC as well as a trainee. Then we've got the postgraduate deaneries. I'm not sure we call them LEPs anymore. This is from a website, but you will have your deanery. It's your deanery, crucially, that issues your national training number for you. So if you haven't got that already, please get in touch with your deanery to request that, because we will need that as well. The deanery and the local education providers are your kind of day-to-day, I suppose, your day-to-day contact. So they will, the postgraduate deaneries will ensure that the curricula that we publish are implemented, and they will arrange your rotations if you have them. Crucially, they will also arrange your ARCPs. So Eva will be talking through the LEP system with you later, and we do, the LEP system does manage the ARCP process, so you can complete all your documentation through that, but it's the postgraduate deanery that set the ARCP date and make arrangements for all of that. But as you can see just from that very brief description, the college is involved in all of these things. And if you're ever not clear, or if you're ever not sure, I always say contact the college. If we can help you, we will. But if it's not us, we will point you in the right direction. These are just a couple of the GMC documents that we work to. So these set out the standards for postgraduate curricula. The most recent curricula has to incorporate the generic professional capabilities framework, which you can see there. And they also set standards for the deaneries as well in implementing the work that they do. So these documents are really important to us at the college because we follow them, but they are all available if you wanted to take a look, if you're interested in a career in medical education, for example. Just a brief note about the National Training Survey, and you may well have completed this already if you've come through internal medicine training, for example, but this happens every year. The GMC will survey you and trainers and will publish the results of those surveys. So you should receive notifications of those, and as I said, the publication of the results of those will also come out and be freely available. So currently the deaneries work through the statutory education bodies, which are there on the left. We have NHS England for now, and the other 3 devolved nations. Again, this is just a sort of brief overview of the types of things that the deaneries are responsible for. And those are things that if you've got queries around any of those, you should be able to go to either your educational supervisor or your training programme director, and they should be able to help you with any of those issues that arise. Just a quick mention as well about the Gold Guide. Again, you may be aware of this. It includes rules around foundation training, so you may have had need to sit for that, or if you've done a core training period as well. But this is really quite helpful. It sets out the arrangements of the 4 UK health departments, but there's quite a lot of useful information in there for you if you decide, for example, that you want to train less than full time, if you want to go out of programme. We will be able to support you with all of those things and provide additional guidance and help. But this is a really helpful document to look at, and I would generally advise to look at that first, because it really will give you the sort of basis of the information that you need. There's lots of information in there as well about the ARCP process, for example. It's quite long, but you can dip in and out of the various sections that are relevant to you at the time. So do take a look at that if you haven't already. Curriculum, so you'll be hearing all about the curriculum from Dr. Mishra, but just to make you aware that the curriculum that you're currently following was implemented in 2021. And it merged the pre-existing chemical pathology and metabolic medicine subspecialty curricula. We've been through quite a lengthy period of review with the GMC in mainly 2024, started in 2023, where we reviewed the curriculum and took part in a pilot QA process with them. Out of that, it was a really helpful review. We had 14 actions that we identified as a college that we wanted to take forward, but we didn't identify any immediate changes that needed. Just so you're aware, though, one of those actions was to look at a change of name for the curriculum. Now, this is quite, it's one of those things where, unfortunately, the college is not actually in control of the name of its own curriculum. It's something that the Department of Health and Social Care had to enact. But we have been through an internal process in the college, and we have agreed through council that we would like the curriculum in future to be called Clinical Biochemistry and Metabolic. That's been notified to the GMC and also now to the Department of Health and Social Care, and we are waiting back from them about how we now manage this change. But we are led to believe it is quite a lengthy process. But if in the course of your training you start to see clinical biochemistry and metabolic medicine, then that would be the new. Just also a quick note about accelerated training. The curricula that were introduced in 2021 are based on high-level outcomes. We call them capabilities in practice. And it allows for much more flexibility around recognition of training periods. So training that you might have done prior to your entry to our specialty. It allows recognition of accelerated progression if you're really racing through the curriculum and doing really, really well, then you may be able to follow the process to complete a little bit sooner. And also our sort of long-standing recognition of periods of out-of-programme training as well, but we've just slightly tweaked some of that process as well. That's all on the website for you to have a look at, but I'm just flagging it so that you can be aware of it, particularly if you're coming into clinical pathology with prior training in specialty. Also, just a quick flag for our Totem Pro card. So I'm very old, so this used to be called the NUS card when I was at university. But this is a card that you can purchase, which allows you to get a range of discounts to various retailers and other things. I think you can also get money for train travel and lots of very helpful things like that. This, you might have seen that pop up when you registered the training, because that's the page that I've taken this from on this screenshot. But do have a look at that because we've got an agreement with Totem Pro that you carry on using that if that's something that you use when you're at university. That's helpful. Finally, just who to contact within the college. So you've got the training team and you've met Jenny and Adby already. They can help you with all aspects of registering with the college, questions about the curriculum, the syllabus, the ARCP guidance, any questions about CCT, and then any advice about training and accelerator. And speak to Sandra and Eva about the LEP system and workplace-based assessments. And you can speak to Luke and his team about the Pathology portal, and you'll see Luke a bit later. And then once you start thinking about taking the Part 1 and Part 2 exams, then the exams team is obviously your port of call. That is about everything for me. I know this is has been a real quick whiz through everything and just a little conscious of time, but do take as I say, some time to go through the college website. If there's anything you want to pick up, you can put a question in the Q&A, or you can send us an email after. But welcome once again.
Thank you very much, Jo, for that really nice overview of what the college does and how the college contributes to training. So next we've got Dr. Kevin Deans, who's the chair of the panel of clinical biochemistry examiners, who's going to give you a guided tour of the RCPath exams. So I'll hand over to you, Kevin. Thanks.
Thanks very much. Let's just pop this onto full slideshow, and hopefully you're seeing my full screen now, but just shout if you're not. So quick whistle stop introduction to FRCPath exams. We obviously realise that exams are something that are at the best of times stressful, and we want to make sure that the exams are as fair a process as they can be and as positive an experience as the situation allows. And because obviously the hard truth of the matter is that you need to get through FRCPath and pass FRCPath as part of the requirements for completion of training. So FRCPath is the appropriate professional qualification for medical trainees progressing to CCT in chemical pathology. Clinical scientists also sit the FRCPath exam, clinical scientist training in clinical biochemistry. The key thing is that it's assessing your knowledge, skills and attitudes in relation to the curriculum. So the curriculum that Joe has already shown you, which is available on the website, that defines the scope of material that is examinable in the exams. So that tells you what's in. The exams are split into two parts, with part two being split into some modules, which I'll describe as we go through. The part one exam is generally anticipated for medical trainees, for yourselves, that you'll sit part one during ST4. You have to have passed part one by the end of ST5, and when you come to your ARCP at the end of ST5, if you haven't passed your part one, that would lead to an outcome 3, usually with recommendation around extension to training time. It's 25% knowledge based, 75% application of knowledge, and it assesses basically knowledge and its application across the sort of curriculum as detailed there on the slide around both laboratory issues and the more clinical issues around chemical pathology of disease within the scope of clinical biochemistry, chemical pathology. It's a multiple choice exam, single best answer format. It's a 3-hour exam. It's sat and delivered online. So you do the maths, 180 minutes divided by 125 questions means that you've got a little bit more than a minute on average for each question. I'll show you an example question in a moment, and on the website we have published some past questions to give you an idea of what to expect. Over time, hopefully we'll add some more questions to that, so that we don't really want there to be any surprises when you come to sit this exam. So we want the information on the website to give you the sort of information so that you know what to expect. So here's an example. Basically, each question is structured like this, where there's a stem. So this one, investigation of the aldosterone-renin ratio for detecting primary hyperaldosteronism can be affected by many antihypertensive drugs. And then there's a lead-in. What effect do angiotensin receptor blockers have on aldosterone and renin and the aldosterone-renin ratio? All our questions are designed so that actually, if you know your stuff, you could actually answer them without looking at any of the 5 options. And you could actually go down and just, you could answer the question, then look for that option. But there'll be 5 options. They're always listed in ascending alphabetical or numerical order, and by the time you come to the exam, you'll think, all right, okay, so I know what angiotensin receptor blockers do. So they're going to reduce your aldosterone, and then through loss of negative feedback, they increase your renin. So your renin is going to go up, your aldosterone is going to go down, aldosterone-renin ratio is going to go down. And so you're going to look for that answer and you go, all right, option B, there you go. So don't worry, I realize you're very early into training, and this exam you'll sit after you've had a decent amount of time in training. But that gives you a sort of typical example of the sort of questions that you'll sit. So you sit your part 1 paper, and hopefully get some good news when the results come out. Hopefully you've passed that, and then in due course you go on to part 2. And part 2 is split into 2 modules, imaginatively numbered module 1 and module 2. Module 1 is split into 2 papers. So in the morning, and this is at a central examination centre, usually in London, but the centre is an ounce and plenty of time before each sitting. You sit what's called the OSPE, the Objective Structured Practical Examination. It's no longer one of these exams where a bell rings every 9 minutes and you move around a station. It used to be like that. You now actually get the whole paper given to you at the start, and you sit at a desk and you've got 3 hours to work through your 19 stations. Obviously, average is about just over 9 minutes per station, but how much time you allocate to each question is up to you. Some of that will be looking at laboratory output, so serum electrophoresis output, for example, chromatography scans. Some of it will be looking at clinical scenarios, so you might be given a scenario where a doctor phones you up from the ward, wants to know what the sample requirements are for such and such a test, or a dynamic function test protocol. Quality control data, you would expect that at some point you're going to see internal quality control data, external quality assessment data. Simple calculations that are related to the job, basically, are likely to appear. We're a bit less calculation heavy than we used to be. So again, if you want to know what's in and what's out, look at the curriculum, look at the syllabus, and it's going to be calculations that are relevant to the day job, basically. And there's one written communications station as well. So that's your 19 stations, and that's a 3-hour paper. Contributes 60% of the marks for Part 2, Module 1. Here's a sort of typical example. This one's up on the website. All this information's on the website, by the way. There's no secrets as far as this is concerned. So you get given a bit of a scenario here, which basically leads you into, you're going to try and work out somebody's blood alcohol concentration using a chromatography trace, and it'll provide you with the trace. And don't panic when you look at this and think, what is this all about? I have never seen this. Don't worry, by the time you come to the exam, you'll be well familiar with this sort of thing and looking and knowing which numbers do I take, which calculation do I do, to be able to work out what is the quality control sample acceptable and what is the patient's result. So that's the sort of level of calculation that might be expected for some of the questions. And by the time you come to do the exam, I would expect you to be well familiar with doing that sort of thing. So you then go and have your lunch, and you come back in the afternoon for a 3-hour what we call written practical. And again, gone are the days where we actually get you to do bench practical work. That used to be what was required, but now it's a written practical. So you'll be given some sort of scenario, might be around evaluation of a new lab method, or comparison of a new lab method with a previous one, or troubleshooting an assay that there's been some concerns about. And there'll be 3 sections. In section 1, you'll be asked to plan an experiment or a series of experiments to answer an analytical problem. Then the second section, you'll be given some data that you have to interpret. Maybe you have to draw some conclusions, maybe you have to do some calculations, maybe even have to plot some graphs, that sort of thing. And then section 3 would be drawing it all together and making sense of what have you found out, what do these results show. And all that's marked is your written work in your answer book. So again, by the time you come to the exam, hopefully if you're getting the right sort of training, you'll be ready for that sort of thing, and your written practical counts 40% of the marks for that module. So that's your Part 2, Module 1. Results come out. Hopefully you get good news, and then you come back and do Part 2, Module 2. You can sit Modules 1 and 2 in the same sitting if you want. That's quite a lot of work, and I guess if you're thinking of doing that, you want to be clear about why you're doing both in the one sitting, but it can be done, and different people take different approaches to. I would say most people split them and do them in different sittings, and that spreads the workload a bit. Some do choose to plough on and do them both in the same sitting, and that is allowed. Part 2, Module 2. Half the day consists of a written paper, imaginatively called Paper 3. It's a 3-hour paper. It involves 2 journal articles, what we colloquially call critical appraisal, and 6 clinical cases. And the journal articles contribute half the marks for the paper, and the clinical cases contribute half the marks. So again, this is one that's on the website. We'll provide a paper that's going to be relevant to the specialty area, and you have to read this paper. You'll be asked some questions on it, so it might be a question of can you read the paper and extract the appropriate information from it, or can you read it and communicate the key points to a non-lab based audience? Can you read the paper and work out if the findings of this paper are applicable to to your lab, to everyday practice, whatever. So you'll see some of the sort of questions that are asked there, and there are 2 journal articles, 2 journal papers that you would have to look at for that part of the exam. 6 clinical cases. So here's a clinical case here. Again, for the clinical cases, think, what would I do in real life? Because if you've been well trained and if you're up to speed, what you do in real life is likely to be the right answer. We don't put in trick questions. We try to, we want to assess, are you ready for independent practice in the day job, basically. So here's a sort of example. Again, it's on the website, and this one's a set of blood gases. You have to interpret them, work out some metabolic acidosis, do some calculations to work out what might be the cause of this metabolic acidosis, and some questions around that. So again, by the time you come to the exam, hopefully this is the sort of thing that you're ready for, and perhaps almost expecting. Again, the curriculum defines the scope of what what is potentially going to be asked. So that's your written paper in Part 2, Module 2, and the other half of the day is an oral exam. Oral exam, there are 2 sections. So before section 1, you'll come in half an hour before section 1 and be given 2 questions on paper that you can go and gather your thoughts, make some notes. The notes aren't marked, but it gives you a chance to gather your thoughts. There's a management question in that section. You're up with 2 examiners, and then medics have a clinical scenario. Scientists at this point have an analytical scenario. You then move on to another pair of examiners for the second section. It's 4 questions that you haven't seen before, 1 on lab safety, 1 on clinical safety, and 2 clinical scenarios. And the examiners know that this is stressful, that you're sitting there in an oral exam, and often people do find it the most stressful bit, and the examiners are very much there to try to put you at ease and get the best out of you. And the briefing every time, we remind examiners of that we're there to try and let people perform, let you perform to your best. And really, by that point in the exam, you've proved a lot by the time you've got that far in the exam. And really, we're wanting to assess: are you safe, sensible, and legal? Are you safe to be practicing independently? Are you sensible? Can you comply within the laws that are applicable? And that's really what this is about. So again, say what you would do in real life in the day job, because that's likely to be the right answer. Basically, again, we're not there to trick people and trip them up. And then, so there's an example there. There's a management question. This is one that we've used in the past. It's on the website. So basically, you're on call. It's Friday night, and your entire lab block has just burnt down. What do you do? And of course, you've got half an hour beforehand to plan out your answer to that and the clinical question. And you'd go in and you'd have a chat with the examiners and talk through what would you do. And again, just think through what would you do in real life. Try and organise it. Try and show it to the examiners that you've got an organised approach. So you can think, what would I do immediately? What would I do in the medium term? What would I do in the long term? It's worth working through those scenarios. Get one of your trainers to give you a mock or chat through some of these sort of scenarios, so that you've had a chance just to try to answer these sort of things under a little bit of pressure and make sure you can answer, organise your thoughts clearly. But examiners do know that you'll be nervous. They will try and put you at ease. They're not there to make this any more stressful than the situation itself tends to mean. There's a question we've used before for the medics on the website again. Severe hyperammonemia in a neonate. And just again, we're looking for, can you recognise that this is a clinical emergency? Can you give the right information, the right advice to the clinician, recognising the urgency of the situation and what further investigations and treatment are appropriate? So by the time you come out of the end of that, hopefully it's good news, and hopefully you are in the position that you've satisfied the examiners and you've passed the exam, and you have then hopefully the joys of getting involved in college work as a fellow rather than as an exam candidate. Basically, how do I sum that up? we're working hard to put as much information on the website as we can, so that this is not so there are no surprises, there are no secrets basically, and we want this to be as fair an experience for you as it can be. We know exams are stressful, and we just want to want this to be as fair and respectful and, dare I say it, positive an experience as the situation permits. Now I need to dash off to another meeting, but I will come back for the Q&A session at the end of the morning, and if anyone has any questions, then I'll try and address them at that point. Meantime, thanks very much.
Thanks very much indeed, Kevin, for that really, really good overview of the FRCPath exams. We all need a little bit of fear in our lives, but hopefully you've persuaded everyone that the FRCPath in clinical biochemistry is a fair exam run by a very sympathetic group of examiners and isn't something to be fearful of. So, thank you for that, Kevin. And next up, we have Dr. Vinita Mishra, who is the chair of the College Specialty Training Committee in Chemical Pathology. And Vinita is going to talk you through the chemical pathology curriculum and give you an overview of how your training is likely to hang together over the next few years. So I'll hand over to you, Vinita.
Thank you, Ronan. Can everybody see my slides?
Yes, we can.
Okay, great. So first of all, I would like to introduce myself. I am Vinita Mishra. I'm a consultant chemical pathologist from Liverpool, and I have been the chair of Chemical Pathology College Specialty Training Committee. So today I'm going to give you an overview of the chemical pathology curriculum. Just a minute, I think my cursor is having some problem. Here you go. So in this talk today, I'm going to describe the role of the chemical pathologist, the training pathway and curriculum related to chemical pathology, and the assessments which should be undertaken during the training program. So first of all, let's see what is the clinical biochemistry. So clinical biochemistry is a specialty which deals with the analysis of body fluids such as blood, urine, pleural or peritoneal fluid, and the CSF to help with the diagnosis and the monitoring of the disease. Metabolic medicine is an integral part of the clinical chemical pathology. So basically, chemical pathology is clinical biochemistry and metabolic medicine, the metabolic medicine being the subspecialty of chemical pathology. Metabolic medicine is the study of metabolic pathways in the body, treating patients with underlying metabolic disorders. The role of the chemical pathologist is both laboratory and the clinical duties which they perform in day-to-day practice. So chemical pathologists, they lead the laboratory services by providing the clinical and scientific direction to clinical biochemistry lab. The chemical pathologist helps with the interpretation of biochemical investigations in relation to underlying clinical conditions. They also provide the clinical advice to the clinicians in managing the patient's biochemical abnormalities. In addition to this, the chemical pathologist, they support the lab in developing protocols and guidelines in treating and managing these biochemical abnormalities in the hospitalized patients or in the primary care. Therefore, a chemical pathologist is a link between the lab and clinicians where they participate in the MDTs and they provide their expert advice to the clinicians. They also support the lab with research and the audits. So, metabolic medicine is a clinical side of a chemical pathologist where they manage the screening programs related to antenatal, neonatal, and cancer programs. They also lead clinics and manage the patients with the cardiovascular risk. They provide a direct clinical care services in managing the metabolic disorders which are related to lipids. So in the lipid clinic, we manage the patients with the cardiovascular risk. We assess their cardiovascular risk and we treat them. We also treat and diagnose the patients with the familial hypercholesterolemia. We do the bone metabolic clinics, where we treat the patients with osteoporosis, Paget's, calcium, and mineral disorders. We are also part of the nutrition multidisciplinary support team in the hospital, managing patients who are on parenteral and enteral support. And here we provide our biochemical advice to these patients who are on parenteral and enteral support. We also manage patients with the high cardiovascular risk diseases such as diabetes and hypertension. We have an expertise in managing and treating the patients with the inborn error of metabolism, both in the adults and children. We work along with the urologist in setting up the renal stone metabolic clinic, where we manage patients who are making the recurrent kidney stones. We plan a biochemical investigations and we treat them and manage these patients to prevent further formation of the kidney stones. So we have a wide spectrum of metabolic medicine expertise here. So let's look at the training pathway for our specialty. So the training pathway, as you all know, the criteria for the training pathway is that any junior doctor with 2 years of the foundation training program and minimum 2 years of core medical training or internal medicine training with an MRCP is eligible to apply for the training post in chemical pathology. The training period is of 5 years, starting from ST3 till ST7. And at the end of the training program, a trainee who has successfully completed the 5 years of the training program will be awarded with CCT. Now, besides MRCP, the trainees who have 2 years of core pediatric training plus MRC PCH or core GP training plus MRC GP can also apply for this training program. Even the trainees who have done ACCS plus FRCA Part 1 can also apply for the chemical pathology training program. So the specialty training is for 5 years. The trainees in the specialty will initially develop knowledge of the laboratory work together with the supervised clinical liaison and validation of results and direct clinical care. Trainee will demonstrate that they are achieving competencies as recommended by the curriculum through the assessments. Following the completion of the RCPath Part 1 examination, trainee will continue to develop skills in the laboratory and in direct patient care with greater responsibility and less direct supervision. After passing the RCPath Part 2, they may also pursue in specialist interest and can develop further expertise in that particular area of metabolic medicine or clinical biochemistry. The CCT in chemical pathology will be awarded on the recommendation of the Royal College of Pathologists following the evidence of satisfactory completion of the chemical pathology curriculum and the minimum training period. So for that, you have to have satisfactory outcome in the work, in the assessments, and also you have to complete your RCPath examination. So let's talk about the curriculum. So each curriculum or each pathology subspecialty curriculum outlines capabilities in practice, also called SIPs, which describe the professional task or work within the scope of the specialty. Each curriculum contains both generic and specialty specific SIPs and each SIP has a set of descriptors associated with the activity or task. Descriptors are intended to help trainees and trainers in recognizing the minimum level of knowledge, skills, and attitudes which should be demonstrated for an entrustment decision to be made. By the completion of training and award of CCT, the doctor or the trainee must demonstrate that they are capable of unsupervised practice in all the specialty SIPs. So generic SIPs cover the universal requirement of all the specialties as described in the GMC, Generic Professional Capability or GPC framework. The six generic SIPs are here, and each trainee has to show a satisfactory sign off for each of these generic SIPs, and this will allow them to progress to the next level of the training. Now, there are specialty specific SIPs as well, which describe the laboratory and the clinical task or activities which are essential to the chemical pathology practice. And there are 5 specialty specific SIPs which have been described in the curriculum, and it is essential to the practice of chemical pathology. Again, a satisfactory sign off will demonstrate that trainee is performing satisfactory against each SIP. Generic professional capabilities and the medical practice. This is the good medical practice, which is embedded in the GPC framework. The framework describes the requirement to develop and maintain key professional values, knowledge, skills, and behavior. The framework describes the principles, duties, and responsibility of the trainee, regulatory response to the most common concern about patient safety and fitness to practice within the medical profession, and inform the curriculum design and assessment. And there are 20 domains of the GPC framework which are mapped to each of the generic and specialty SIPs of chemical pathology curriculum. So these are the generic SIPs for chemical pathology which has been outlined in our curriculum. And these are the specialty specific SIPs for the chemical pathology. The syllabus for chemical pathology has a broad scope covering both the laboratory and the metabolic medicine aspects. A trainee should be able to demonstrate SIPs and GPCs in each of these areas as outlined here in the syllabus. The trainee will need to become familiar with the relevant knowledge, skills, and attitudes related to these areas. And the focus of the syllabus is on the patient, who should always be at the center of knowledge, learning, and care. So let's talk about the assessments. So the assessment of the SIPs involves wide range of different skills and behaviors to make the global decision about the trainee's suitability to take on a particular responsibility or task. So assessors will be expected to indicate whether the trainee is meeting expectations by using the following global anchor statements, which includes meeting expectations for this year of training and progress to the next stage of the training, above expectation of this year, again progress to the next stage of the training, but below expectations may not meet the requirement for the critical progression points. So assessment is usually undertaken by the educational supervisor, who will make an entrustment decision for each SIP and record the indicative level of supervision which is required. They will provide all this information in their education supervisor report, which is called ESSR. And this ESSR will indicate the most appropriate global anchor statement, which I have mentioned already for the overall performance of the trainee. And each trainee should have an access to LEPT, which is on the college, which will be provided by the college, and your ESSR report should be uploaded on the LEPT. So this is the assessment of the specialty specific SIPs, which I have already mentioned. These are the global anchor statements which will be used to assess your performance in the last 1 year. So what is the learning theory behind the assessment? The learning outcome of assessment is to provide evidence that trainee is progressing from knowledge to understanding and finally to a competence and achieving the performance which is required at that stage of the training. And this is through the formative and summative assessment. The formative assessments are the assessments which are carried out in day-to-day practice. So this includes the workplace assessments. It includes the feedback on those assessments by your supervisors, by your peers. Also, you will be undertaking an MSF during your training program. The summative assessment include the examinations, which is FRCPath Part 1 and Part 2, and which my colleague Dr. Dean has already spoken about. So basically, the underlying principle of the assessment is the experiential learning based on the Kolb cycle of learning. And this cycle describes learning by action. So while you are undertaking assessments, you are gaining new experience by carrying a particular task either in the lab or in the clinical practice. After you have done that task, you reflect upon that task and you gain the learning. And this creates a new learning which you then implement in your practice. And therefore, it sets up a cycle of learning. This new learning through self-assessment, which is your reflection, supported by external feedback from your supervisors or by your peers, will consolidate the knowledge acquired, contributing to the trainee's professional development plan. So the formative assessments, as I have already mentioned, these are the assessments which you are undertaking in your clinical practice, in your laboratory practice. You are acquiring the competencies based on those tasks. So this formative assessment, which is also called workplace-based assessment or WPBA, includes DOPS, which is a direct observation of clinical practice or laboratory practice, CBD or case-based discussion, ECE or evaluation of clinical events, and MSF. So the minimum requirement of each of these assessments is given in this table during your training program, and you have to demonstrate that you have carried out these assessments, and this will be included in your ESSR report. So FRC path examination, I'm not going to go in detail because it has already been discussed with you in the previous talk. So part 1 is the assessment of knowledge, and this you will sit at the ST4, pass by the end of ST5. The part 2 you can give any time within 7 years of passing part 1. There are 3 critical progression points or the key progression points during the chemical pathology training program. The first is at the entry to the specialty. The second is the at ST5, where you complete your FRC path part 1, and ST7, which is the end of your training program, where you are awarded with CCT. Now, I'm sure you all know about ARCP, or the Annual Review of Competency Progression. Now, this gives an opportunity to the trainee to provide evidence of their progression in the last 1 year of training. And the documentation of these competencies are collected and presented in your portfolio, which is your ESSR report, and it is submitted on the left. Now, this ARCP can be carried anytime between 12 months to 18 months of your training period. All the evidence should be collected, documented, and this provides a evidence about your performance and progress in a holistic way, and helping your trainers to make a decision about your progression into the training program further. So this is about the ARCP, and we have got 6 outcomes, and then another outcome is 8, which is for the academic out of program trainee, and this is very well mentioned in your curriculum. Now, we also provide flexibility in the training. You have an opportunity. You can apply for less than full-time training or out of program training. Now, less than full-time training is any trainee who can apply for 50 to 80% of a full-time equivalent. Now, this training is pro rata. So that means your assessments, your training duration, your study or annual leave will be pro rata. But ARCP will always be once a year. Out of program training gives you an opportunity to take the time out of training for more than 3 months. During this time, you can undertake a research or a clinical training in a prospectively approved center by GMC, and then it can count towards your CCT. You can also take out of program leave to gain any clinical experience, which is not in the NHS, or you want a career break. So to summarize, the curriculum outlines the chemical pathology training requirement for delivery in a training program. It not only guides the trainees, but it also guides the trainers as to what is required to deliver the curriculum. It provides trainees with the information in the learning and the assessment methods required for the satisfactory completion of your training in chemical pathology. College has a special role in monitoring the quality of the curriculum and assessments, whereas your local deanery or your regional deanery has a role in monitoring the training program, and they ensure that the training program delivers the chemical pathology training as it is outlined in the curriculum. We will encourage all of you to register with the college, get yourself familiar with the chemical pathology curriculum, which is on the college website, and I hope this talk is helpful and useful to you. Thank you for your attention.
Thanks very much indeed, Vinita, for that very nice overview of the curriculum. So we're running slightly ahead of schedule right now, so I'm just going to take a little look to see if we're ready to go. And yes, I can see Eva there, so we are ready to go. Fantastic. So our next speaker is Eva, who is the ePortfolio officer at the college, and she's going to talk you through the LEPT system. Now, I know that many of you, all of you, will have come from different types of medical training, some from IMT, some from general practice, and all of you will have used a portfolio of some kind in the course of that training. But LEPT will be completely new to all of you, so I'm sure you're going to find this useful, a useful overview from Eva.
Thank you very much, Ronan. So this is going to be a little whistle-stop tour of how to get onto the LEPT system and what you can do on the LEPT system and how you can manage your ePortfolio. As I was already introduced, my name is Eva. I'm the ePortfolio officer, and myself and Sandra Dua, my manager, are essentially the LEPT team. So if you have any queries regarding your ePortfolio and the LEPT system, you always can come to us. So let's start with the beginning, how to get onto the LEPT system. Relatively straightforward. So you just go onto the college website, and the link to the lab system, which is short for Learning Environment for Pathology Trainees, will be on the right-hand side of the screen. You have received, so when you registered as a trainee, the training team will have sent you information on how to log in to the system for the first time, but essentially this is how it looks like. It will ask for the email address that you registered with as a trainee, and then your password, and then you click login. Now, when you log in for the very, very first time, you get a slightly different screen, which I will show you as well. Bear with me. So that screen will look thusly. Pardon me. So the first thing that the system will ask you is to select your educational supervisor and select your training program director. And this information will be provided to you by your local deanery. So this is not something that we will know. You will have to ask the deanery about this, and then you will have to select them in order to move on to the next screen on the lab system, which then will look like this. So there is always this little welcome message, and if you ever forget how to get in touch with us, when you log into the lab system, you will always have this email address here, assessment@rcpath.org, and Sandra and myself will pick up the message as soon as possible, and we'll try and help you wherever we can. So I will first talk you through your ePortfolio homepage, which is this. So this top bar here where it says release, this is where you can select your professional relationships. So after each year of training, your educational supervisor might change, your TPD might change, your head of school, etc. So when you click this release button, you will get the option to select your new relationships, and the relationships means the people who have access to the information in your ePortfolio for the purposes of the ERCP review meeting. This section here that's called alerts, this is how we try and communicate important information with you. For instance, this is information on where you can find the lab instructional videos. So Sandra and my predecessor have recorded some incredibly helpful little videos on every element of the ePortfolio, of how to create assessments, how to do MSFs, etc. So if you get stuck, and for some reason you don't want to ask us, you can go and check the videos, and they're really short, really concise, very good. And this is information on the lab drop-in sessions that we will be running from the 6th of October to the 16th of November. So as I said, this is going to be a whistle-stop tour, and if you will have some more in-depth questions, you can come to any of those drop-in sessions. The taskbar here is to let you know that you have pending tasks. So, for instance, you have an assessment that has been approved. You have some personal training development items that you haven't completely finished yet, and the taskbar will essentially remind you of that. Most trainees find the training card the most useful element of the ePortfolio in terms of the homepage and at a glance information of how you're progressing in terms of the curriculum in the year. So the training card will contain information about your year of training, when your ARCP meeting will be, the status of your ESSR, and then all your professional, so your main professional relationships. So who is your educational supervisor, your TPD, your head of school, who's going to be your panel chair, any external ARCP representatives. And this is all information that you can get from your deanery, you will get from your deanery. And then we have the traffic light system here. So this is essentially following the curriculum that Dr. Mishra just talked us through in terms of indicative number of assessments. So as a year one chemical pathology training, you would need 6 case-based discussions, you would need 12 direct observation of practical skills stops, you would need 6 mini clinical evaluation exercises and 1 MSF. In year one, the MSFs will be initiated for you by us at the college around March time. So you don't need to worry about that. We will set this up for you in March, and you will be getting emails about this and information on what you will need to do to have your MSFs completed. As you can see, you have a navigation bar here at the top as well. So this burger menu is essentially contains the home page. So if you kind of added any kind of assessment or looked at any kind of documentation and you want to get back to this page, you just click home. Then here is your profile section, where you can edit certain elements of your ePortfolio profile. So certain elements you won't be able to edit, that's only us who can do that. So if you like any changes to be made, for instance, to your year of training, you would need to get in touch with us. We can do that for you. But you can add information, you can add a picture to your ePortfolio, you can add your CV to the ePortfolio, and then this is where you add your GMC and NTN numbers, which we would ask you to do because it's helpful to have that. And this is also where you log out. You can also log out from the system when you click on the little mannequin here and then click log out. The first tab is portfolio. Because you only started now, you won't have any old left records. So this is for trainees who've been training since 2022, because we changed to this new system in 2024. So all the items that they had on the previous system have been uploaded here. So you don't need to worry about that. This is quite a useful place if you want to see all of the items that are in your ePortfolio at a glance. So as you can see your assessments all in one place, your resources all in one place, all of the activities that have not been assigned, all of the resources that have been assigned, and then you can download them from here anytime as well. So if you, for instance, want to kind of have like one little neat folder at the end of every year, you can just click download and then you will have that as a zip folder. One of the most important tabs here is the Assessments tab. So this is where you will create your workplace-based assessments. There is the Create and List tab. So this is where you create the assessments, and also you have them listed, all the assessments that you've created over the years. And under this tab, you will have the information on your examination results. So after each exam, the college uploads the information of your outcome to the system, and you will be able to see it here. Now, the next tab is your ARCPs. So as Dr. Mishra mentioned, ARCP stands for Annual Review of Competence Progression. And this is where you create an ARCP. And then at the end of each ARCP, you will receive an electronic outcome form with your outcome, and you can always check under this tab all of the signed off and finalized outcome forms will be listed under this tab. Training and development, so any kind of teaching you do, any courses that you attend, any logbooks, for instance, you can upload here, and everything that you upload into these areas will be also listed in your ESSR, which is a vital document for your annual appraisal. Some of you might be on 6-month rotations throughout your training or in your training year. This is where you can list this rotation of which hospital you were in, etc., in what position. And then resources, so any kind of extra item you can upload here. So one of the good ways to use this is that sometimes we might be a little bit behind in terms of uploading the exams results, but you will get a letter confirming your results. And if the college hasn't uploaded the exams results to the system yet, then you can just upload the confirmation letter under resource, and it will also show in your ESSR. And then this is the help button, which contains all the useful documents that might be necessary for you to kind of have a little refresher. So here is the information on the category of MSF assessors that you can select for your MSF, Mortisol's feedback, sorry. Here is the link to the instructional videos. These are all documents that will download for you. This is information on the drop-in sessions I just mentioned, the joining details, etc. And then if you want to contact us, so as I said earlier, you can just email us at assessment@rcpath.org, but you also have the option to fill in this contact form, which is also will be picked up by Sandra and myself. So I want to talk you through quickly also on how to create an ARCP and how to create assessments as well. So to create an ARCP, you click on Create and List, and you click Create. So you probably won't have your ARCP date just yet. So the ARCP date is the actual ARCP meeting date, but it will be, so if you started your training in August, it might be sometime June, July time. So I will select a date in sometime in June 2026. Your training period, so let's say we started on the 19th of August and the year will run until the 18th of August, then 2026. And then if you have any information that you feel is necessary to add, so anything that you want the panel to know about any kind of issues that they might want to take into consideration, you can put information on here about that, and then you click Save. So once you create your new ARCP, when you click your home button, your training card will change. So this is the new training card. So as you can see, the ARCP is June next year. The ESSR has not yet been submitted. And this is your new professional relationships. If you want to change your professional relationships, and you can do that either through the release button, or you can just click here as well. It takes a few seconds to open. But then once it opens, it's relatively straightforward. It's drop-down menus. There we go. So I will select Sandra as ARCP panel chair. So you can type in the first three letters of the person's either surname or first name, and then you will get a list of names from which you can select, and the person most likely will be on the list, and then you just click Save. And then Sandra is now the ARCP panel chair. Now, the next most important thing that you want to know about is how to create an assessment. So you just click Create a List, and then you're here, Create. You select who will be approving the assessment. So Sandra will be approving this one. And then you choose what kind of assessment you would like to complete. And in this case, I want to complete a direct observation of practical skills. And you complete all of the areas that are marked with a red asterisk. So you select the assessor's status. You add the information in the relevant boxes. You select what this event was about, and then add information into it, because otherwise you won't be able to save it. And then you just click, you either can just save it as a draft and then come back to it to complete it, or you submit to the assessor once you feel you've added everything that you need. And then once you've sent it off, the system will take you to the assessment list page. And as you can see, this is the assessment that we just sent off. And it tells us that the assessment is waiting for approval from Sandra. You have a radio button here. So you can, because doctors are all busy in hospitals and consultants and scientists, so sometimes they need a reminder. You can do that through the system. And the system sends out a template email reminding them that this assessment is still waiting for their approval. So here is one I created earlier. In the week, I sent off an assessment to Dr. Joe Bloggs, and I sent them a reminder, and there is a little date and time stamp of when the reminder was sent off. So you don't need to worry about, okay, I've sent too many reminders, because you will have the information when you last sent one. And then once an assessment is approved, you can add them to your ARCP. So there is an assessment here that has been added to, has been already approved. What's really important is the assessments need to be in the date range of the ARCP in order for it to be able to be added as an item to the ARCP. So you click on this assessment, and then this has already been associated with the SIPs and the GPCs. So I don't need to worry about that element, but I will show you that as well when Sandra approved the assessment. And then once you've done the association, you go on to options, the 3 dots here, and then you click ARCP. And then the system gives you the option to either keep in portfolio, because for some reason you decide, oh, actually, I might not want to add this assessment to my ARCP, or you can add it to the open ARCP. So I would like to do that now, and you just click assign. And then when you go back onto the home page, you will see that your training card updated with 1 DOPS. So every time you add an assessment to your ARCP, it will appear here on the traffic light system. And then for ease of use as well, so if you want to know which assessments you've already added, etc., you can always click on the number here. It will be hyperlinked, or it is hyperlinked here. You just click on it, and then it will tell you, oh, this is the DOPS from the 4th of September. Now, to check if Sandra has already approved our assessment that we just created, this will also show up on your taskbar. So this is the assessment that Sandra just approved. So you can access it either via the taskbar and do the associations with SIPs and GPCs through this hyperlink, or you can go into create and list and then just click on this little radio button, and then you go in here. So here are the capabilities in practice that Dr. Mishra talked us through earlier on. And let's say I select SIP 5 and then select these 2, and the GPCs will automatically complete corresponding to the SIPs that you selected. And then you just click add. Pardon me. And then you have the option to immediately add this assessment to the ARCP, or if you don't want to, you can always come back to it on the create and list, and then you can just click on the assessment and then go back into it and add to ARCP. And then let's have a look how it updated the training card. We now have 2 DOPS on our traffic light system. So this is relatively straightforward. Now, for every ARCP period, you need to produce an educational supervisor structured report, or ESSR. Is quite an essential part of your documentation for the training year. And to do that, you will have to at least have 1 item in your ARCP. We now already have 2 in here, so we will be able to create the ESSR. So for that, you just go to ARCP's create and list. you go to the most recent ARCP that you have open, and you check that you have the minimum number of 1 items in there. So you then click Progress, and then the Create ESSR button will be available to you. So when you click Create ESSR, I will do that as well so that you see the substantial amount of documentation that and information this form will include. So the system will ask you if you want an ESSR and if you really, really want an ESSR. So you click both, and then you click Create ESSR. It will contain the information about your about the person who will be doing the structured review with you, the details of your educational supervisor, your details. This will include your GMC and national training number. And then there will be certain elements that you will have to complete yourself on this form. You don't have to kind of do it all in one sitting. So this is also an assessment that you can kind of start working on at your own leisure. But there will be a deadline by which you will have to submit it to the educational supervisor, because they will have to go through the form. You and your educational supervisor have to sit down and talk it through together, and this will have to all be ready and available by the time of the panel meeting. So at each element you can just save the form, so you don't lose anything. So this won't be having any information for you at year 1, obviously, yet, but subsequent years, the form will list all of your previous ARCP outcomes and ARCPs, any placements, any gaps in training, all of your workplace-based assessments. As Sandra has commented on our assessment, we've done really well, and this will be also listed in the form. Any examinations that you might have set in the period of the ARCP, and then any logbooks that you've uploaded under training and development, any audits, research projects, publications, teaching activities, management development that you participated in, presentations, courses, events, anything else. These are the elements your educational supervisor will complete. So there's no need for your input here. You can't even input in there. And then you can either just save it and come back to it as a whole, or when you feel, okay, I've put everything in there, you can submit and send to other party. So then it goes to your educational supervisor, who will then have to do their bit. And then, as this is also an assessment, this will also appear on your assessments create and list page. As you can see, it's waiting for approval by the educational supervisor. And when you go back to your home page, this will also be hyperlinked here. So it will, you can actually click on the hyperlink, but it will just show you the draft version that you've sent off, but it gives you information at a glance as to what the progress is on this form. And then I'm just going to look at my cheat sheet. Yes, so I talked about the multi-source feedback that will be initiated by us at the college for you as year 1 trainee. And I think the last thing I wanted to mention, so the deaneries have various timelines as to by what time they want all of the items on the portfolio to review prior to the meeting. But ideally, you don't want to leave this too late, because at certain point, the ARCP will also not allow you to add any further items. If it comes to that, you can always contact us and then we can help you and we can add items to you. But ideally, you're really well organized as chemical pathologist and do everything on time and put everything in there on time. But if you have any issues, any problems, the portfolio is not listing things that you feel you've added to it, there are any issues, please either email assessment@rcpath.org or just fill in this contact form on the help button. Under the help button, and under the help button, the assessment email address is listed again here, and our phone number, so you can also call us, and we will try and help you out as soon as possible. Yeah, so we are here to support you. We are here to make sure that your experience of this ePortfolio is as smooth as possible and does what it needs to do for you. I think I have mentioned everything. So if anybody has any questions now, you can ask.
Thanks very much indeed, Eva. There's a lot to get to grips with the new ePortfolio system. I see you've got we've got one question here, so maybe this isn't a bad time to just go ahead and take a question. Although I'm mindful that that mics and cameras have not been enabled. So actually, let me reverse back and say maybe you would just hold that question till the end whenever your mics and cameras have been enabled, or else type it in the Q&A section and we'll pick it up at the end of all the presentations. So,
okay.
Sorry. Okay.
Thank you very much.
All right. So moving on through the program, we're covering a lot of ground today. So I hope that you're all managing to keep up okay. Bear in mind that this session is being recorded and is going to be on the website in a week or two, that you'll be able to look back at anything. And I think that in particular, Eva's LEPT talk will be really useful to reflect back on, because there's a lot there about a new system that it takes a little time to get to grips with. So our next speaker is Luke. Luke Thrower is the Pathology Portal Officer at the college, and Luke's going to talk us through how the Pathology Portal can be a useful resource during your training.
Great.
I think I saw Luke arrive. Are you with us?
Yep,
Great.
I'm here. Let me just pop the presentation up on screen for you guys.
Okay, I'll hand over to you, Luke. Thank you.
Perfect. Thank you, Ronan. Okay, is that showing up okay for everyone?
Yep, we can see that.
Yep, perfect. Thank you very much. So, hi everyone. As Ronan said, my name's Luke. I'm the Pathology Portal Officer here at the college, and I'll just be giving you a brief overview of the Pathology Portal. The Pathology Portal is a catalogue on the NHS England digital learning platform called the Learning Hub. It's designed to enhance the learning experience for those in pathology or pathology-related roles. We cover undergraduates all the way up to those with years of experience. And we provide access to over 6,800 resources, and we have more being added all the time from over 100 contributors. To date, those resources have been launched more than 350,000 times by just under 7,000 users, and we've been really fortunate to be recognised with some awards from the HSJ and Healthcare Honours, and our transfusion editors collected an award for the work that they've produced on the portal. We've also been included in a parliamentary response to a question around the work being done to address training around digital pathology. So this is a screenshot of the homepage of the Learning Hub where you can log in. Lots of emails are now able to self-serve and create your own accounts if you don't have one already. So if you have an NHS, a .gov, AC, doctors.org emails, you should be able to set up a Learning Hub account yourself. But for anyone else, or if you do run into any issues, you're welcome to get in contact with us. We'll have our details at the end of the presentation, but it's quite straightforward to get an account set up for you. You then have the catalogue. So once you're logged in, you'll have the catalogues available. The Pathology portal is the most accessed catalogue on the Learning Hub, so you will find it nice and easy. But you can also bookmark the catalogue for your convenience as well as any resources that you're interested in, so you can keep them in an easy to access place. We have the folder structure for the portal, so you can see that all of the specialties are listed, and then we have a really varied range of resources, but some specialties do have some more than others. We're communicating quite regularly with the editors and engaging with the data to address gaps and find new ways to collaborate with the specialty and promote the work that goes into the resources. Inside those folders are then subfolders, and so these start drilling down to more specialist areas, and this is reflected in the other overarching specialties as well. And so this is some examples of the cases, and on the next couple of slides we're going to walk through what one of those cases would look like. So this case is a good example where we've been able to utilize a few different elements of the tools on the Learning Hub. So here we're getting presented with the information that's related to the case and to reflect a real world environment. So we've got some patient information, past medical history and drug history on page 1. And then at the bottom of that page, we're met with a question which relates to the information. And then on answering, you'd be given some related feedback. When we then progress on to the next page, we get to the next step. So there's more information, there'll be follow-up questions, and it just guides you through the process a little bit and gives you a good chance to sort of review things that might become more familiar in a clinical setting. The portal includes other resources, so these include things like structured hematology tutorials. We've had hematology editors producing morphology sessions that are aimed at ST3s, and again, these are kind of replicated across different specialties for different things. They've uploaded the cases to the portal beforehand, and we're able to use them on a Teams call to demonstrate and run the session. So trainees able to access the materials alongside those who are delivering the training, and then those training sessions themselves recorded and uploaded so that they can be rewatched. But also for people who weren't in attendance initially, they're able to get the benefit of that training again in the future. So this provides a really good space for learning that trainees can access at their own pace. It supports your self-study alongside led sessions. And we've provided a lot of support with editing recordings of Teams and Zoom calls. The example here, we're currently receiving monthly lectures from the UK HCDO, but we're also talking to lots of other contributors in other specialties who are delivering short lectures on other topics on quite a regular basis. Another example of this is where we've uploaded pediatric pathology slides seminars. So again, archives of materials where they're delivering teaching to use the Pathology portal as host for slides and teaching sessions so that learners can view the slides simultaneously. And this has also been working with Adrian Flanagan, who is provided an incredibly large archive of soft tissue tumour content, and working in a collaboration with people like that so that we can add content so that the knowledge doesn't become lost. We've also had support in international teaching. Richard Byers' program in sub-Saharan Africa, his content was uploaded before he went there to deliver the teaching. But again, it's just a case of the portal being a place where we can provide that content over time and retain the value of teaching so that others can access the opportunities afterwards. And this provides a great opportunity for trainees to engage with diverse cases that you wouldn't be able to get exposure to otherwise. You are able to use the search function to find specific content if there's a particular topic that you're interested in. We have a wide range of methods of doing that. So there are keyword tagging, but there's also the ability to search through the content that's been typed out. When you log into the college website, you'll be able to find a single sign-on link as well under the My RCPath dropdown, so where your college account can be linked with the Learning Hub account to make your access easier. And then those who have integrated the portal into their training have found it really helpful. From a teaching perspective, if you get involved in that, it increases engagement, and we see regular spikes of access around times like exams and around these new trainee welcome days, and where we've gone off to other conferences and presentations where we know that we're circulating the portal. So as I say, these slides have just been examples. The team are always really excited to hear how individuals might want to use or apply the tools. The support team are really happy to talk through anything as well. So if you do want to get in touch with us, our email address is there, pathologyportal@rcpath.org. But really, if any of you would like to get involved, we have a really busy chemical pathology editorial group, and they would be really keen to help to get help in whether that's helping to create structures for content, uploading content, editing. They would be really keen to hear. So if you think that you might want to get involved in the pathology portal, feel free to get in touch with us, and we can have an initial chat and put you in touch with some of the editors to let you know about the work that's going on in chemical pathology at the moment. And we're supported by the editorial board as a whole. We have a whole community of the contributors, and it's really useful for us being able to seek out advice from others, to share learning that's going up and developments with the portal, and really improve the experience of use for everyone. We have got a QR code there as well, so if you do have any feedback on the portal or the presentation, and if you would like to sign up to the portal, you can find that information on the pathology portal page on the college website as well. As Eva mentioned, with having drop-in sessions, we are also setting some up. So the information about that will be available on the college website, and you'll see stuff on the college socials. So the first one of those is coming up at the end of the month. So if you'd like any more information through that perspective, feel free to drop by, and myself and some members of the team will be around to answer questions there. So that's everything from me. Thank you very much for your time. I know, Ronan, you've just mentioned about picking up questions at another time as well, but that has been the Pathology Portal. Thank you very much.
Thanks very much indeed, Luke, for that very useful whistle-stop tour. And just to give the portal another plug, you mentioned how new trainees might in due course want to contribute to the portal. I would kind of emphasize that that's a really useful thing if you want to have some evidence of your contribution to teaching and training to put in your portfolio. So that's a nice way to do it. So just to kind of plug the notion of developing portal for the content for the portal. Yeah. Okay. Thanks very much again, Luke. So next we have Aggie and Matthew, who are currently in chemical pathology training themselves and are members of the college's Trainees Advisory Committee. So I know from past experience that Aggie and Matthew have some very sensible and practical advice to give all of the new trainees today. So I look forward to hearing this year's update on what they have to say. Hopefully they're both here and are ready to just jump in.
Yes, I'm here, and I think Matt is here as well. Yes.
Please, thank you.
Hey.
So hi everyone, my name is Aggie. I am currently an ST5 and I work in East of England at Addenbrooke's.
And I'm an ST5, just turned ST5 at Imperial, so south, northwest London officially. I think, do I just share my my presentation? Is that the best way of doing it?
I think so.
Yeah. Right, I hope everyone can see that. We lost the Bertie. I hope you like my little animation there as well. So some of you might have already met us if you're on the group, or if you came to the to the research meeting last week as well. But we'll just run through some things about ChemPath and metabolic medicine, or what is hopefully in the future going to be called clinical biochemistry and metabolic medicine. And then I think Aggie's going to take over and talk to you a little bit more about some of the practical things to sign up to and sort of so forth. So first of all, welcome to a really fantastic specialty. Aggie and I both often sort of talk to people about how it really allows you to be a physician, a pathologist, and a scientist in this specialty. And those are sort of the three things I'll just quickly sort of focus on. So very much from the pathology side of things, your training is really to sort of help you understand laboratory theory and analytical methods, and how you can utilize those to give really good interpretive and clinical advice from that. And it's something that you're probably very sort of unused to going through any sort of core training. It's not something that's well covered anywhere. I have put a photo on the right of the TEATS textbook of clinical chemistry and molecular diagnostics, and really that's a sort of your up-to-date reference guide for laboratory medicine, really. Then also laboratory management and leadership is another big part of the role in terms of both clinical leadership and also in terms of thinking about safe service delivery. So make sure from day one you get involved in management meetings and sort of understand how the laboratory is managed and run. And there's sort of lots of opportunities to get involved in there, even as you start in ST3. The exams very much test all of the above. They can seem very overwhelming at the start, and definitely even the TEATS textbook, if you were to pull one out and look at it, it can seem very overwhelming at the beginning. But in terms of places to start, you've just heard about the pathology portal. I'll mention somewhere else to start shortly. But definitely when you sort of first look around the lab and get shown around the lab, just think about sort of all the different areas of the lab and what they're doing. And obviously biochemistry underpins a sort of very broad area of medicine and diagnostics. But you start to get an idea of just sort of going around the lab of exactly sort of what the sort of main things that you need to know and need to sort of look out for are. In terms of the sort of physician side, I guess the sort of more direct clinical care side is really thinking about the link between the laboratory and clinical teams. And in terms of the definitely the more direct clinical care is largely an outpatient based specialty, but there are opportunities for inpatient reviews and advice, and I think do definitely get involved in those if you're given the opportunity, because it's good for sort of doctors on the wards to see us and know that we exist and what we do. So three sort of core areas. I know that in the past people have really described these in sort of 5 areas, but thinking about cardiometabolic medicine as a whole, CVD risk prevention, and then thinking about electrolytes, minerals and nutrition, so electrolyte disorders, your hypernatremia, phosphate, calcium, etc., metabolic bone disease, renal stones, and then things like total parenteral nutrition and nutrition related disorders. And then something that you probably not had any experience with so far is inherited metabolic diseases, and these adult presentations of rare inherited diseases, but also inherited diseases that were diagnosed in childhood, and newer treatments have meant that people have survived through to adulthood, and are now being taken over by adult services. And the sort of final part that's worth mentioning is that there is so much opportunity for research in the specialty, not least because labs have so much data. Labs are doing lots of different things, whether that's focusing more on new methods and new tests, or using that data to answer sort of clinical questions and things. So definitely get involved there's lots of opportunities, and definitely thinking about things like PhDs down the line. I think everyone should think about a PhD in the specialty. Both Aggie and I at the moment are sort of getting ready to apply or applying for a PhD. So if that's something that you're thinking about and you haven't heard much locally about, then please get in contact with us, and we'll happily chat to you about that as well. But you don't obviously have to do a PhD as well. You'll still be doing lots of research and things through the specialty too. Just a quick mention on analytical methods. It can seem quite hard to start. People say things like mass spec and liquid chromatography, and you might never have heard much about any of those before. So first of all, try not to get overwhelmed, and if you find a lot of information online that seems like you don't understand it at all, don't worry about that. We at Imperial did actually organise an analytical method lecture series that you can go through, and you can access it through metmed.info. It's and you just type metmed.info into your search bar and it will come up. It's also available on the Pathology portal as well, and you've just heard about all the resources that they have on Pathology portal as well. So I think that's everything I wanted to say, and I'll sort of hand over to Aggie to continue.
Hi everyone, so I'm Aggie, as I have already mentioned. It's lovely to see such a fantastic turnout today. Welcome all to the specialty. So I will start off by saying a few things that I think might be worth joining at the start of your training. So I'm assuming, because you are all here, you have already registered with the college, which is a great first step. So you should all be getting access to your portfolio. You might already have it, or you might be getting it shortly. And then another great resource that the college works very closely with is Association of Laboratory Medicine, so ALM. There is a discount for registrars. It's about £13.50 a month at present, and they have quite a lot of good resources and also have a conference every year. So it is definitely worthwhile thinking about joining ALM. There's also a free ACB ClinChem email distribution list, and if you essentially type it into Google, it should come up. It's called the Mailbase, and it's quite a helpful resource. So a lot of the time there might be issues, for example, with certain reagents or analytes or interesting cases, and it's a very nice network of both chemical pathologists, clinical scientists, and actually BMSs, where they try to approach those problems and also troubleshoot or highlight any difficulties they might be experiencing across board. Another great association that also works closely with Royal College of Pathologists is Association of Clinical Pathologists. So this is just for doctors, so there are no clinical scientists within this association. It's not just limited to chemical pathologists, it also involves histopathology, microbiology, all the pathology specialties. It's free to sign up. You can, again, if you just sort of Google the association, there's a clear website. They do provide good leadership courses, and there is more and more involvement from chemical pathology as well. So I would highly recommend signing up. A few conferences. So UK MedLab, this is run by Association of Lab Medicine, and happens annually, and it's a very laboratory sort of based, focused conference, as a lot of chemical pathologists actually present posters or do oral presentations at this conference. And I would say it's great to attend, both for understanding the sort of common and topical issues within the lab, and also for networking. Another important conference is Heart UK. So this is a lot more clinical. Heart UK is a cholesterol charity. And again, it's great to stay up to date for cardiovascular disease. And also it's a great networking event for other chemical pathologists across the country and even from other countries. There's also sort of it's an American Association of Clinical Chemistry, so more of an international platform, which has a lot of great resources. They also have a very helpful sort of slightly intelligent learning based platform for some analytical methods that might be worth exploring. So that's AACC. And Matt, could we move on to the next slide, please? Another quite helpful resource, a lot of you might already have joined, but it's our trainee WhatsApp group. So it's an unofficial group, as it's quite difficult. We are a small specialty relatively, so a lot of us tend to collaborate and raise issues more on a national level rather than within our deaneries. It's a friendly group, it's free to join, and it sort of follows more infrequent messages, advice, discussion. It can be quite helpful if someone is looking for some revision groups or buddies for upcoming exams as well. And here is sort of the WhatsApp QR code for it. If anyone is interested in joining us, there are about 80 to 90 of us on the group. Could we move on to the next one, Matt? And now a little bit about Trainee Advisory Committee. So when I first joined the specialty, I wasn't quite sure about the various committees that we were part of. So I thought it might be great to explain a little bit about different ones and how we are involved. And also, hopefully, some of you will be joining us for any opening positions. So they are often advertised through the RCPath website. So first of all, what is Trainees Advisory Committee? So this is one of the committees which is just for trainees, and it involves all pathology specialty. So things which are discussed during this committee are specific to training, not just chemical pathology training, but training and trainee support in general. So things like structures of exams, assessment, any upcoming curriculum changes, trainee well-being and support. So the meetings happen twice a year. There are also sometimes interim meetings. And there are questions portals open prior to each meeting. So I'll always try to advertise them, usually through the WhatsApp group, just saying that the questions portal is open. And in terms of the questions portal, that can be sometimes a good opportunity to mention some specific issues within the specialty that you have been experiencing that can then be reviewed and answered. A lot of them come up time and time again. So unfortunately, things like the cost of exams, the time it takes to mark exams, those are things that have been brought up a few times and unfortunately cannot be changed. But any other things, please do raise. Could we move on to the next one? Another two committees that we are part of as chemical pathology, and I represent us on all three of the committees. So the second one is the Specialty Advisory Committee for clinical biochemistry. So this one involves both clinical scientists and chemical pathologists, and it's essentially, it's a committee for anything that is happening across clinical biochemistry. So there might be some of, for example, the recent difficulties that you might have heard of with HbA1c and having to recall multiple I think over 50,000 results. That was something that was brought up in the Specialty Advisory Committee, or ongoing audits. There's also a trainee perspective provided to the committee, both from chemical pathology and clinical scientist training. Finally, the College Specialty Training Committee. So this is probably the one that is often most focused on our training. This is where all the training program directors from all the regions across the UK meet to sort of discuss any plans or changes to training, or any matters arising specific to training. Probably the best way to feedback to this committee would be through your TPD, or contacting myself. Matt is also involved with this committee through his work in cardiometabolic subspecialty committee, and also IMD subspecialty committee. So that's another way of giving feedback. Could we move on to the next one, Matt? So your feedback really matters, and I think over the last year and a half, there has been a lot of engagement from various registrars, and it has really made a difference. Different views are encouraged. So something that I want to emphasize is our aim is to be as impartial as we can be, and please feel free to provide, honest feedback, even if it might be not necessarily something that the majority of other registrars feel exactly the same about. It's important to get everybody's point of view across. We are happy to be contacted at any point and try to sort of pick up any concerns or issues, or try and guide particularly any ST3s towards resources, see if we can resolve things quickly. If there are any urgent issues, they will be raised prior to scheduled meetings. So I know, for example, there was a period of time where there wasn't a sort of assigned TPD for one of the regions. We're in the Yorkshire deanery. So that was raised quite a few times between the scheduled meetings. We are here to support you. And something that I just wanted to highlight as well was we've had fantastic recruitment rounds. So this round was particularly competitive. So congratulations to everyone who managed to get training number to join our specialty. For the first time, we've had quite a large number of doctors from core pediatric backgrounds, and something that has been raised in one of our meetings was that it would be fantastic to get your feedback on how you are finding the transition from pediatric medicine into sort of adult and lab-based specialty. So please do let us know how you are getting on, and whether there's anything that you think could be done better for future cohorts, or any other way we can support you. Next slide, please, Matt. Great. So I think that's everything. And the plan was as well to now have a bit more of an informal discussion with trainees, I think, which I think the plan was that it wouldn't be recorded anymore, and everyone would hopefully turn on their cameras.
That's right, Aggie. So first of all, thanks very much to you, Aggie, and to Matt as well for giving us a really nice talk. I think that it's really useful for doctors just starting in a training program to hear from their slightly more experienced peers who are, moving well through the program, because I think your perspective is really useful. So thank you for that.